Good morning, everyone. Yate abene. Thank you for joining us today. It's just after 11 a.m., and we'll get started here momentarily as we just allow a bit more time for others to join. But we're really looking forward to a meaningful session together today.
Good morning, everyone. I see that a few of you have joined. We're just waiting a few more minutes just to let people trickle in.
نهتأجل. Let's see, is my microphone?
I should message her.
All right, everyone. Hello again, and thank you for your patience. We're excited to welcome you to today's featured presentation, part of the Center for Native American Cancer Health Equity's quarterly webinar series. We'll go ahead and get started now. My name is Jennifer Hudson, and I'll be your webinar moderator today. I serve as the Senior Community Program Coordinator with the Center for Native American Cancer Health Equity, or C-NACHE as we refer to it, and I am a proud citizen of the Navajo Nation, so I'd like to first briefly share my plans to establish any kinship connections I might have on the call. I am of the Mountain Cove clan, born for the Blackstreet Wooded people. My maternal grandfathers are of the Towering House clan, and my paternal grandfathers of the Water's Edge clan. And I'm joined today by my colleague, Chastity Begay, who will co-facilitate this session through the webinar chat. Chastity, I'll turn it over to you for a brief introduction.
Good morning, everyone. Chastity Begay Yanishya, Mai Dashkini Nishle, Totsotni Bashichin, Auto Torchini Dashanella. I am a research coordinator at NAU, and like Jen said, I will be co-facilitating, but more on the chat side. So it's wonderful to see everyone here today.
Thank you, Chastity. We are happy to announce that we are also joined today by members of our 2025 Native American Student Webinar Advisory Coalition program. That is Billy Bragg, who will help verbally moderate the session, and Sunflower Husky, who will be helping Chastity with the chat facilitation. Our NASWAC scholars are instrumental in guiding and advising our quarterly webinar series, and we are excited to have the opportunity for this year's cohort to be more actively involved in the webinar series itself. So with that said, I'll go ahead and turn it over to Billy and Sunflower to briefly introduce themselves as well. Billy?
Hello, my name is Billy Bragg. I am from the White Mountain Apache tribe. I live here in Chandler, Arizona. I currently work with the Gila River Indian community, and I go to school at Tono Alton Community College in Arizona. I'm currently in the JAS and also the life science program here. And other than that, I will be helping with the webinar with Jennifer as well.
Great. Thank you so much, Billy. Sunflower, can you introduce yourself?
Yeah, hello everyone. I'm Sunflower Husky. Sitting on Ginny Nishle, Tetnazani Wajchin, Twitchini Dash Tate, Hachini Dash Shanella. I'm from Tuba City, Arizona, and I'm currently a senior at Fort Lewis College, getting my bachelor's in public health. And yeah, I'll be helping with the chat today.
Awesome. Thanks so much, Sunflower. All right. Well, to get started, today's webinar is titled From Silos to Synergy, Building Data Bridges Together. And we're honored to be joined by our featured speakers, Yazzie, Director of the Navajo Epidemiology Center, and Tex Etsitty, Systems and Program Manager at NAC. They will each introduce themselves more fully in just a few minutes. But a quick note about today's session, it will be recorded and made available on the NAU Share YouTube channel for those who wish to revisit this presentation. And then this presentation is also funded with grant funding from the American Cancer Society. All right, go ahead, Billy.
Okay, so before we begin, we'd like to take a moment to set our collective intention. Recognize that for many Native Americans and indigenous communities, cancer is a cultural sensitive and sometimes spiritually prohibited topic. Our goal at C-NACHE is to approach this subject with respect, cultural awareness, and care, honoring the deep spiritual traditions that guide many indigenous models of health and wellness. At this time, we invite you to reflect quietly in your own way on your intentions for being here. You may use this moment for personal prayer, reflection, and setting a protective intention for yourself and others as we enter into this dialogue. So starting now, 45 seconds will start. All right, so thank you for taking that moment to ground yourselves. As we continue, we want to acknowledge the land from which we host this session. So on the screen is an image of our physical location in Arizona University in Flagstaff in the San Francisco Peaks, known by that name, but held sacred by 13 Native nations in the region. We honor this sacred mountain and share the following land acknowledgement from NAU. Northern Arizona sits at the base of San Francisco Peaks on the homelands sacred to Native Americans throughout the region. We honor their past, present, and future, generations who have lived here for millennia and will forever call this place home.
Thanks so much for that, Billy. All right. Well, before we turn things over to Dell and Tex, we just wanted to provide a brief overview of who we are here at the Center for Native American Cancer Health Equity, or C-NACHE, especially if this may be your first time joining us here at our webinar series. So established in 2022 through a grant from the American Cancer Society, C-NACHE aims to reduce the unequal burden of cancer among Native American communities. And we do this through three primary goals: improving cancer screening rates, increasing access to cancer care services, and raising awareness about environmental contaminants that contribute to the cancer burden in Native communities. It's through research, community engagement, and partnerships that we strive to advance cancer health equity in Native communities. And this brings me to the purpose of our C-NACHE quarterly webinar series. Our target audience includes Native American college and university students but all are welcome, including community members. This series seeks to spotlight the many forms of cancer research happening across Turtle Island with a focus on the Four Corners region. When many of us hear cancer research, we often picture lab-based science with lab coats and beakers and things like that. But in reality, cancer research spans many different disciplines: public health, environmental science, behavioral health, policy, and much more. So this series aims to highlight the diversity of the pathways available with the goal of inspiring the next generation of Native researchers and advocates. With that, I'm thrilled to now turn it over to our featured speaker, Del, Yazzie, and Tex Etsitty. Del and Tex, the floor is all yours.
All right, great. Thank you for the introductions. And sorry. Yeah, thank you for Jennifer and the team for inviting us to do our presentation here, Tex and I. And my name is Del. I'm with our Navajo Epidemiology Center, located in Window Rock, Arizona. I'm Kintlachini is my mom clan. Tkachini is my dad clan, and Hashkanso is my Che clan, and my Dishkijni is my Nully clan. So and I'm from a small community called Cove, Arizona is where I'm from originally. If you don't know where Cove is, it's over towards Shiprock, New Mexico, but on the Arizona side. So that's who I am, and this is one of our projects here at the center. Cancer, we lead a cancer work group with many partners, which we'll share here in a little bit. But that's who I am, and I'll give some time to Tex. Tex, go for it.
Oh, today, my name is Tex Etsitty. I'm originally from St. Michael's, Arizona, which is close to the Now Nation capital. I've been working with this group for the past 2 years on converting their reports to a data visualization, which is the dashboard that we currently are utilizing. Yeah, great to be here. That's good.
Yeah.
Let's start.
Awesome. Thank you, Tex. So I see a lot of folks on the call that we know, or some are part of our work group members. So great to have them join us. And so this is our Navajo Cancer Work Group. This is the outline of our presentation today. From silos to synergy, building data bridges together. Partnership is really important to me and our team here. Without them, a lot of the things we do are not possible. So we'll do a little overview of who the Cancer Work Group is, and then a little piece on the surveillance data flow, and the cancer report, the latest one that we crafted, along with the dashboard evolution and how it came to be, and give some time to Tex to talk about that. And then the cancer control plan that's currently under construction and what we're aiming to do with that, etc. So as I mentioned, partnership is very important to us. You see all the logos here of our partners who are part of the work group. We meet on a monthly basis. In fact, we're meeting tomorrow, the second Friday of every month, 10 to 11 Mountain Time or Winter Rock time, I call it. So we have partners from federal and state partners from IHS, our bordering state partners as well, some nonprofit also organization as partners, and some academic institutions. And really as you see there, aim 1A is to update the cancer report, which we've done recently, and it needs to be updated again already. So, and to disseminate the findings, and also to build a dashboard, and then to craft this cancer control plan is some of the aims we have currently for the work group. And then, sorry, let me move this. Sorry, I caught a cold, so I'm not feeling all that great currently. So here's the list of the cancer work group members. There are about, I don't know, what, 20 of us. Some have even retired. They're from different places, IHS. And one of the key partners to our work group are folks who are from the state cancer registries, such as Chuck Wiggins, who is the head of the New Mexico Tumor Registry. And also from Arizona is Georgia Yee. She's the director of the Arizona Cancer Registry, along with her epidemiologist, Dana Doyle. And then we just recently strengthened our partnership with Utah, their Huntsman Cancer Center. And that's, her name is not in here yet. It's Dr. Doherty, Jennifer Doherty, is the director of the Utah Cancer Center. And we're strengthening our partnership with them to be a part of our cancer work that we're doing. So, and then, yeah, they're all great people. These guys are all a bunch of nerds. I'm probably the dumbest one among this group. So, so let me see. Sorry. There you go. So just some quick bullet points here. Some of the impact the work group has made. The work group has been in existence for quite some time. Maybe almost 30 years. And really to collect the cancer data, to generate reports. And then we've generated 3 cancer reports so far, going back to 94 to the latest up to 2018, and then cultivating key partnerships. And then we secured some funding from ACS to support our group's efforts. And we crafted and launched the first tribal cancer data dashboard. And then we're working on the cancer control plan. And as some students are on this call, we do really support our own Navajo students and others, non-Navajo as well, in the advancement of their academic ambitions. So we've hosted a number of interns over the years who are now attained their doctor level status, I guess. So, and some of them are still in the works. So we do support a lot of our own students matriculating through our Navajo Epidemiology Center. So that's something that's important to us as well. I don't know why my laptop's not advancing. Okay, So our work group focuses on Navajo Nation. I think you all are probably very familiar with this map and some demographics on the left. One of the many federally recognized tribes, 5 tribal agencies. You see there in the colors on the right. And then 110 chapters, covering a 27,000 square mile land coverage, acreage, the size of the state of West Virginia. Population wise, this is updated recently. We now have over 400,000 Navajo folks, roughly half on the res and the other half off the res. And we're pretty rural. And then this is just a cartoon of the disease surveillance data flow that we are engaged in as far as collecting data. This is probably the most popular way we're currently collecting data. And you see on the left, the 2 logos there, IHS and the 638 Tribal Health Organization's logo. And you see on the top, the green arrow comes directly to us through a file called the Epidemiology Data Mart. And it comes to us on an annual basis. And it basically contains the hospitalization and emergency room visits data, basically encounters of all the facilities on Navajo Nation, comes directly to us, and our own David Foley is the epi that analyzes all that data. And we'll talk a little bit about that too. There's a dashboard currently on our website for that. And the middle one is the IHS data, of course, also flows to our bordering states, Arizona, New Mexico, Utah. And then it also flows to CDC. And in turn, also the state health departments share data with us, the Navajo Epicenter. And so this is kind of a general overview of how the data flows to us currently. We have some ideas on how a lot of the data should be coming directly to us in a more timely fashion instead of once a year more, especially with infectious diseases that are like COVID or flu or RSV, for example, and looking to see if that can come to us on a weekly basis. So those are some of the ways we're working with our 638 and IHS facilities. And then this is just a cartoon that you all are probably familiar with, since you all are in public health. A little diagram on just a little clockwise fashion, collecting data and analyzing and interpreting the data, communicating it and taking action is kind of the thing that we do in support of the Navajo Nation. And then it's just our report. 2014 to 2018, our latest report. I know it's a little bit outdated. You might say it is. Yeah, I agree. This needs to be updated again. I think the latest data that's currently available is probably 2021 or 2022. So we're not that far off. There's always a gap in the data. I know it's 2025, but there's usually 2 or 3 year gap delay in the actual data. So 21, 22 is probably the latest cancer data that's currently available. So we're working on updating this. Currently we're working with an intern from U of A, Kevin Begay. Some of you might know him. He's doing his MPH and Epi at U of A, and he's helping us update our cancer dashboard. So maybe later this, I was gonna say later this year, but it's almost the end of the year. Maybe in the springtime, we'll have an updated cancer dashboard, but we'll see. Just very quickly, I have here from the dashboard, the most diagnosed cancers or cancer types, both genders combined from the latest report. I'm not gonna go through each one here, but the top one is female breasts. And on the dashboard, if you hover over the bar, it'll give you the number the count of cases, followed by colorectal, followed by kidney, prostate, uterine, stomach, thyroid, non-Hodgkin's, lymphoma, etc. And then you can go to the dashboard and look at all this. This is top 10 causes of mortality for cancer. The top is colorectal, followed by prostate, pancreas, stomach, kidney, female breast, lung, liver, ovary, and gallbladder, like top 10. Again, you can see this on the dashboard as well. You can see the actual numbers. And then here, the report, just some highlights. Overall, compared to previous years, there are overall lower rates of cancer, which is good. Good to see. I think a lot of kudos should go out to folks who are out in the field, promoting disease prevention and health promotion efforts, and also, screening efforts and education among our people. I think speaks to a lot of the lower cancer rates that we're seeing across time. And then just some clusters of cancer that shows in our latest report are stomach, kidney, liver, and gallbladder. And just again, incidence trends as well as mortality. There are a lot of flat and reductions since 2010. Again, that's a great sign. Hopefully we'll begin to see some reductions or decline in rates as well going forward as we continue to collect the data. And then the biggest disparities continue to be or related to the stage of diagnosis. We continue to see diagnosis of cancer in later stages, which is not good. It's harder to treat, less options for treatment, and also survivorship is not as good. And so we want to see stage of diagnosis at an earlier stage, which really goes to the next part is screening. Really, screening is very important, of course, in early detection. And so that's some areas that we really need to continue to focus on. And then here's the dashboard. This is the title there. We put the first tribal cancer data dashboard in the US. We've had this for over a year now, and nobody has proved us wrong, or said anything. So we continue to use it to say that this is the first tribal cancer data dashboard in the US. So this is all the work of the work group again. This is not really me or the cancer or the epicenter. This is a team effort from all the people that I showed you. And it has everything pretty much from the report, incidence, mortality, stage of diagnosis, etc. Is all within the dashboard. So the next few slides, I'll hand it over to Tex and have him go through. Tex, you want me to cover this or you want to cover this?
I can cover it.
Okay, go for it.
So why we use dashboards? It's kind of telling a story from a report. And originally the first report was about 50 pages long. So trying to find a way to minimize the size and the language of it, basically trying to tell a story of how Now Nation's cancer data. And with this, we do share data we do get data from other places. And how do we house this data? How do we collect this data? We do use a cloud-based computing system, which is the cloud. And from there, we use multiple tools, such as Tableau, which is the backbone of the dashboard. And we do use data analysis tools such as SAS and RStudio. And for mapping wise, we use GIS. And throughout the months, years, we did have in-person meetings with other stakeholders collaborating on how to show this data into a visualization. And once we got that finalized and going through the pains and stakes of the technical side of the dashboarding, we were able to publicly face it. You can visit that through that website. And the purpose of this dashboard was to give information to the public and have them navigate through the dashboard to find filter it by years, filter it by gender, filter it by rates, stages. So that was the gist of the whole dashboard. And with the dashboard process, we did start with Tableau prep, which is a data cleaning. It prepares the data. With that, we did use 3 data sets, which is mortality, stage, and incidence. And with each data set, we would have to clean, removing fields that we don't need, fixing variable names, trying to get everything aligned to each other so they can merge with one another. And once we got that down, or data cleaning done, we were able to combine all 3 data sets into one, which is the main file of the cancer dashboard. And next slide. So once we got done cleaning the data set, we were able to push it out to Tableau Desktop, which we used to collect or connect the data set to the dashboard. And from there, we were able to fine tune things, meaning that we can use multiple data sets. You can see in this picture right here, the top bigger one, you can see how it's overpowering by information. You can see by each data set has its own corresponding with gender, the map, the year, the count, the rate. And from there, we were able to break it down and using certain kind of filters, using inside calculation, meaning that if a kidney cancer was available in 3 data sets, we were able to filter that using coding or programming languages. And from there, we're able to set up bar charts to represent the data of high to low. And you see on the left side, there is filters on the year, gender, group, and the conference intervals. And from there, we were able to share it to the public through the NEC website. With this, it was more user active, meaning that someone can do their own research on this data set. And hopefully within this coming year, we'll have map level data, meaning that you can hover over a section of the nomination and see based on agency or county. And from there, you will have better understanding of the area that you're in. And working with this software, it ties back to a lot of programming, a lot of data analysis, a lot of integrates of computer science, which my background is. And it's just a better representation of data, I believe. So if you were able to go to the NEC website, you can see the PDF report and you can compare and contrast to the dashboard, which is pretty interesting to see how many pages of the PDF report correlates to the dashboard and how simple it is to have a better understanding. Back to you, Dale.
Yeah, thank you, Tex. Yeah, so it's pretty complex, which I tell you, I'm not. I'm a dummy, so I don't know about this whole part. So thank you, Tex. Yeah, this whole IT computer side of things, the dashboard development took some time, and thanks to Tex leading our team to craft this up. and to get to this point. We still need some work to do on our dashboards as far as, making it easier for folks to read and understand, and also especially with our other IHS Epidata Mart dashboard with some definitions, with certain the meaning of certain terms, etc. All we still need some work to do on that. But for now, this is a great accomplishment for us. It was one of our work group goals, and we we essentially did it. So with Tex and others putting it all together. So it took some time, but we did it. And Dirk, I don't know if he's on the call. Dirk, Dr. DeHare from NAU is also a key member of our work group. Has really led a lot of these efforts with us to get us to where we are currently. So we thank him a lot for his contribution and his input, his insight, and also his leadership. So yeah, he's great. Um, and then last, just little um, words on our cancer control and prevention plan. This is also the work group's one of our aims to craft this. And you see the chapter box on the right, upper right, are some of the chapters that are part of this plan and is still being crafted. We'll be meeting, I think, next month here in a couple of weeks to finish it. It's almost completed. So we're aiming to complete it hopefully by next month. And really this will be the first ever also as a Navajo Nation cancer control plan. And what are we going to do with it? Uh, that's a really good question. I'm not really certain. I think the engagement there with stakeholders, really the engagement of our Navajo Nation leadership, because part of the plan involves, there's a public health piece to it, and also there's a lot of clinical side of it. So all the public health folks, clinicians need to come to the table to execute the plan, in my opinion, and also to engage our council, Navajo Nation Council, Office of the President, Vice President, to help us, really it's going to take a lot of resources to execute this plan, and the full engagement of our Navajo Nation leadership is critical, and maybe even establishing some policies to execute the plan is probably what it's going to take. So, but we're really thankful to all the work group members who are part of this crafting of this plan. And there are a lot of NAU folks involved, Jennifer and her team, and there's Dr. Tufel-Schoen and Dr. DeHare, Dr. Sanderson, Priscilla Sanderson, Otto Shama, Carol Goldtooth Begay. There are a number of folks at NAU who are really helping us push this forward, getting us to where we are currently. So a lot of kudos goes out to them as well. So I think this is our last slide. So sorry, this is my last slide. We just last week, our manuscript got accepted for publication. This is the work group's first publication ever. So we're really proud of this. We need to throw a party at some point. So to the Cancer Journal, American Cancer Society, and it was accepted for publication last Tuesday. And the title is there, Cancer Incidence Stage at Diagnosis and Trends Across the Navajo Nation, 2014 to 2018. will be published. I don't know, probably until sometime next year. You'll see in the journal, I think. I could be wrong. So we're really proud of this. Again, all the people or the work group members are part of this effort. So we're thankful and grateful for the partnership. So with that, here's our contact info, and the funding that is providing the support for this work is there as well. Our email, phone, website. Yeah, go to our website and check out our dashboards and feel free to give us some feedback. We want to make them better or improve upon them. So, Jennifer, we're going to stop here and hand it over back to you. Thank you.
All right, thank you, Dell. I'll turn it over to Billy for our Q&A session.
All right, I wanted to say thank you so much for Dell and Tex for sharing your insight and experience with us. So now we'll transition into the Q&A portion of today's webinar. We especially encourage our student participants to ask the first round of questions. After that, we'll open up to the audience. So you may ask your question by unmuting or raising your hands in the Zoom or typing into the chat, whatever feels comfortable for you. So let's go ahead and open the floor.
I have a question for either Dell or Tex. I I'm an undergrad student and I do a lot of work with Tableau and other data stuff. Was it hard to implement this in your study, like I guess teaching your coworkers or teaching your team how to use this program? And have you seen like, have you thought of using any other programs like R or Python to utilize the data?
Hi, Shannon. Good question. I'll have Tex chime in, but just, yeah, I think a lot of this stuff is new to us. Not just me, but also at our Naval Epicenter. The new tools with the newest and latest technology on how to use them is much of it is also new to us. And we're also at the beginning stages, the learning stages of how to use these types of tools to communicate not just the data, but also how to collect the data, to house the data, and to manage the data and the analysis. And as Tex went through some of the steps on making this happen, the dashboard, using all these latest technology, the tools, is somewhat new to us, and we're looking to build upon it, yes, going forward. I think as far as training our own team is something that we'll begin to look to on how we can do all this as our other Naval Epicenter team members are work. They also work. They have their own projects. They collect their own data, and how do we use their data to put them into dashboards as well. So other team members are working on STI stuff, sexually transmitted infections. Sai, I see him on the call. Mr. Francisco is the manager for our tribal Burfus. He has a bunch of data that really could potentially be made into a dashboard as well. And then David has all kinds of data, mortality, Navajo Nation mortality data, the IHS epi data which we already have a dashboard currently. It's on there on our website. We're just looking to update it to 2024. The one that's on our website is 2023. So yeah, we'll see how we evolve over time in using these types of tools. So yeah, it's a really I think a really cool topic, and we'll have we'll have Tex train us going forward. So Tex, you want to say anything?
Yes, can you repeat your question?
Yeah, my question was, since you're using Tableau to present this data, how has it been, I guess, teaching your staff how to use Tableau? And do you plan on using any other types of data applications or data like R or Python to present data in the future, or do you want to stick strictly to Tableau?
There's like a, I should say there's a two-part question or answer for this. Yes, we do use R and we use Python to do the mostly the analytics side of it, meaning that we do our rates, we could do our counts, we could do our 7-day moving average, whatever we need to fit our needs. We will, I would program it in Python or R, depending on who I'm working with. If I'm working with a team member that use R, I'll program everything in R. And once that, once the data is looking the way that we want, our calculations are right, we'll transfer that to Tableau Prep. Then we'll clean it more. Then from there, we'll go to desktop, design the whole dashboard, and make it the way that we want as a report or as a storyline. And we do virtuals off to like Power BI, which is another data analytics virtualization, which can do the same stuff as Tableau, but it's not really, how can I say this? There's more features in Tableau than Microsoft BI corresponding to data analytics. So teaching other staff about how to use and navigate Tableau, it is a learning curve because most of them are like, from my background, it's computer science. So I'm more technical savvy, and with others, I would have to break it down to like hands-on training to give them a better understanding of what functionalities that Tableau can offer and how to go about it. Hopefully that answers your question.
Yeah, it does. Thank you.
Thank you for your question, Shannon. Any other students at this time have any questions? If not, we'll open it up to the broader community, but do you want to prioritize any students from any student-related questions?
Hi, Jennifer. I have a question. Hi, Dell. It's Carmen Lita, Chief. I'm now a PhD student in the interdisciplinary health program at NAU. And recently, I want to say within the past month, I believe it was either SHARE or the Southwest Health Equity Research Collaborative that had put on they had collaborated with Arizona Department of Health to put on a workshop on how to just get acquainted with their new dashboard and their new data system. And so I'm wondering, I know that you have to train your staff first, but at some point I'm wondering how soon in the future do you think you might be able to have workshops to acquaint students and other members of the community on how to use the dashboard?
Hi, Carmelita. Yeah, it's a really good question. Again, I think a lot of this stuff is new to us, and as far as training others, I think is something that we would eventually love to do. And the need to figure out a way to incorporate it into our strategic plan at the epicenter on ways of doing that. is something we'll probably have to think about. It is a great tool. It's a great lesson for students who are embarking on their college or graduate level education and wanting to learn more is, yeah, I think it's something we'll definitely would like to entertain with partners as well as even a part of this work group, our Navajo Cancer work group, on ways of doing it. Proposing funding as part of, as I mentioned, Dr. DeHare, who's really a key piece to our work group, and maybe finding ways for funding to support training others to do this type of work is something we will have to maybe introduce among our work group on how to do it. So yeah, but would like to certainly engage more on the topic, Carmelita. So I'll stop there. Thank you.
Okay, thank you. Yeah, I
Yeah.
just wanted to add it was really effective. And so yeah, I think if you were to reach out to somebody at Share who was helping with organizing that, they could acquaint you with some ideas on how to approach that. But
Yeah.
good job overall, and thank you for the presentation.
Yeah. Good luck on your PhD.
Thank you.
Yeah, awesome. Congrats.
Thank you, Carmelita, for that question and idea for the future.
Yeah.
Any other questions from our students? I know we had some in the chat a little bit earlier on, and I can certainly read those.
I have a question, Jennifer.
Oh yeah, go for it.
Hi everyone, I'm Nina Trujillo. I'm an MPH candidate in epidemiology, emergency preparedness, and epidemics with the University of Arizona. And I just wanted to know, what are the biggest data gaps or delays in cancer reporting for the Navajo Nation? Because you mentioned that the data is right now currently up until 2023, 2024. And how can tribal programs or community health workers help improve the completeness of this?
Oh, wow. That's a really good question too. I think among tribal nations, there's a lot of data gaps. I think one, just mainly because the way the data is collected, the data comes to us from different places, and we heavily rely on IHS data. But at other places, they combine, they don't, they put AIAN data into one bucket and they don't separate by tribes. Some places don't even collect AIAN data. So that's one piece. I think two is the data systems. The way data comes to tribal nations is so antiquated, in my opinion, especially at Navajo. As you saw in my little cartoon on the way the data flows, is it flows off the nation first. It goes to the state or CDC. And then in return, we're trying to ask for it back. And that part doesn't make sense to me. And the states want data sharing agreements to share our data back with us. And so that doesn't make sense to me either. So why doesn't the data that flows off the nation come to, for example, the Navajo Epicenter as well? But in order to do that, it's going to require a lot of other pieces, the capability to house the data in a secure environment that's HIPAA compliant. And a lot of tribes don't have that capacity, which we've learned over time, and we're even being challenged currently to we were able to create that cloud-based computing system to store data, but it's quite expensive. And to support and sustain that, we're learning is quite challenging. Hang on, someone's at my door. So there are a lot of, sorry about that. So there are a lot of gaps. And then tribal specific data collection is pretty rare as well. I think my colleague, San Francisco, who I see on the call, is collecting tribal data, which is very unique. And a lot of tribes want their own data. They don't want a bucket that's AIA in general data. And so collecting your own tribal specific data is also very resource intensive. As Sai will probably tell you, doing the tribal births is very resource intensive. You need to have data collectors and you have to pay. You have to get out into the rural parts of the nation to knock on people's doors, to do the survey. It requires that kind of resource as well. And so covering a large land base like Navajo Nation, it can be quite expensive. So, and we deal with that every time we launch the Navajo Nation births. So, so there are a number of reasons or data gaps that make it challenging to collect, tribal specific data. And we're working our way around some of these challenges by ways of, like I said, how come the data that goes off the nation, how can we find a way for that to flow to the Navajo epicenter as well? And so instead of asking for it back. So we're working on that currently, working with IHS 638 facilities. We're talking with them through crafting or creating channels, as the title of this session, building data bridges with IHS 638 facilities directly to the Navajo epicenter to share information, share data in a more timely manner, is one of the ways we're looking to address some of these challenges. So, yeah, so that's, I'll stop there. Thank you.
All right, we did have one question come in about the Tableau software. Rydell Todachini is asking if, since you use the use of Tableau software, do they have any ownership in the data that's being collected or stored within Tableau?
The data that's been shown in Tableau is aggregated data, meaning the stuff that we coded and programmed in other programming languages that results into the outcomes, like total cases, total case counts. Those are aggregated numbers. And with that gets reflected in Tableau. The data itself does not.
Okay, gotcha. So the data is analyzed and aggregated outside of Tableau, and the aggregate data is uploaded to Tableau. Is that correct?
Yes, so the main data sets are not integrated with their system. It's mostly our system.
Okay, yeah. Rydell asks or thanks you for the clarification. Well, we're just at the top of the hour. Thank you all for your questions. We do want to share that Dell and Tex have graciously offered to stay on for an additional 5 to 10 minutes after we formally close the webinar recording. So this is a great opportunity for more informal one-on-one conversation if you'd like to continue with that. But before we officially end, I just want to turn it back to Dell and Tex and ask if you have any final reflections or parting words for our audience today.
Yeah, thanks for having us. Thanks for the invitation. It was great sharing our work. We do have a lot of partners helping us, so we're grateful for that. And to those, I know a lot of students are on the call, so good luck to you all. Good luck and stay in school, study hard, and hopefully we'll be back sometime to maybe present something else. So maybe some other Now Epicenter, my colleagues can present their work as well. They're not cancer related, but something else. But anyway, Jennifer, thank you. I don't know, Tex, you have anything?
Thank you for having us. If there's any technical questions regarding programming, Tableau, and data cleaning, I'll be here for the next 10 minutes.
Thank you both so much. And thank you to all of our participants today. We appreciate you logging on with us. And before you log off, we'd really appreciate your feedback on our webinar series. So if you could take a moment to complete our evaluation survey, you can click the link in the chat, or you can scan the QR code there with your phone or device. This is the last webinar of our series this year. So your feedback is going to be really instrumental in guiding our final year, 2026, of our series and what we should be highlighting there. So thank you again for being here. We hope to see you at the next webinar. And until then, take care and enjoy the rest of your day. And again, for those who wish to stay on for the continued conversation, Del and Tex will be there for just a bit. But have a great rest of your day, everyone. Thank you so much. Bye-bye.